On a Tuesday afternoon, Sarah, 28, was rushed into our ICU in critical distress. Her temperature was dangerously high, over 40 degrees Celsius. She was confused, agitated, and her heart raced. Her blood pressure spiked, breathing was rapid, and she was drenched in sweat. We urgently reviewed her medical history: depression treated with fluoxetine, chronic migraines managed with sumatriptan, and a recent prescription for linezolid, an antibiotic. The combination of these three drugs, an SSRI, a triptan, and linezolid, immediately raised red flags. These medications, when combined, can interact in dangerous ways. Sarah's exam revealed alarming neuromuscular signs: rigid muscles, exaggerated reflexes, and involuntary jerks. Her pupils were dilated, and blood tests showed muscle breakdown and mild inflammation. Toxicology confirmed her prescribed medications. No illicit drugs were found. The team considered several diagnoses: NMS, malignant hypothermia, anticholinergic toxicity, and brain infections. But her medication combination and rapid symptom onset after starting linezolid pointed elsewhere. Linezolid, while an antibiotic, also acts as a weak MAOI, dangerous when mixed with SSRIs and triptans. This interaction can cause a perilous spike in serotonin levels. The clinical picture: confusion, fever, agitation, muscle rigidity, fit a classic pattern. Serotonin syndrome quickly became the leading diagnosis. Serotonin syndrome is a life-threatening condition caused by excess serotonin in the brain. It presents with mental changes, autonomic instability, and neuromuscular abnormalities. Sarah had all three: confusion, fever, and muscle jerks. The Hunter serotonin toxicity criteria help doctors diagnose this syndrome based on symptoms and medication history. There's no blood test for serotonin syndrome. Clinical judgment is key. Sarah's use of fluoxetine, sumatriptan, and linezolid, plus her spontaneous clonus, confirmed the diagnosis. According to the Hunter criteria, this combination is enough for a definitive diagnosis. The first step: stop all serotonergic drugs immediately. Sarah's fluoxetine, sumatriptan, and linezolid were discontinued at once. Intensive supportive care began: IV fluids to protect her kidneys, aggressive cooling to lower her temperature. She received oxygen and was closely monitored. Benzodiazepines were given to control agitation and muscle rigidity. Cyproheptadine, a serotonin antagonist, was administered to reverse the toxic effects. Some treatments, like antipyretics, were avoided. They don't help in serotonin syndrome. The key lesson: always check for dangerous drug interactions, especially with serotonergic agents. Early recognition and decisive action are life-saving.